I'm Kyra.
And I'm Zipporah.
And we are presenting Madeline Leininger's Cultural Diversity and Universality.
Yes. Okay, so my part is the background, and I also got notes on my phone, so I'm gonna be looking down, up and down. But Madeline Leininger is a nursing theorist born on July 13, 1925. Leininger developed the theory of transactional nursing, and she developed this because while her observations made while she was a nurse, she identified that there was a lack of cultural and care knowledge, which is a missing component for nurses understanding the many variations required for inpatient care, like their support, compliance, healing, and their wellness. In 1966, she founded and pioneered the discipline of transactional nursing at the University of Colorado. From 1989 until 1995, she served as editor of the Transactional Nursing Society's journal. Leininger improved the specialization by utilizing the sunrise method idea in 1975, and the sunrise method depicts the components of a culture, which includes worldwide, worldview, cultural, and environmental context. In the early 1970s, transactional nursing programs and track degrees were made available as master's and doctorate preparation after being formally established as a nursing course at the University of Colorado in 1966. And then on August 10, 2012, she died as being the first professional nurse who finished a doctorate degree in anthropology and honored as a living legend of the American Academy of Nursing. And then I'm going to bring it on to Zipporah.
Okay, I'm doing the description. So, what is Madeline Leininger's cultural diversity and universality theory? In 1995, Leininger defined transcultural nursing as the following two areas. It was known as an area of study as well as an area of nursing practice. She described the goal of transcultural nursing to be where the provision of care is specific to that culture, to either promote health or assist individuals who were facing sickness or death in what she known as in culturally meaningful ways. This idea focuses on comparing cultural values, beliefs, and practices for individuals who were from similar or different cultures. So what does this mean in simple terms? It means that we as the nurses must understand and respect the different cultures to provide the most effective health care to our patients. And now I'm going to move it on to Aaliyah.
Hi. All right. So I have application of the theory to the nursing process. So first we have the transcultural nursing theory developed by Madeline Leininger enables nurses to consider a patient's cultural background and how it affects his or her health, and we use that information to develop a nursing plan that will hasten the patient's recovery while remaining mindful to the patient's cultural background. And while it is important to look at a patient's as a whole person from a physiological, psychological, spiritual, and social perspective, Madeline Leininger believed that it is also important to take a patient's culture and cultural background into consideration when deciding how to care for the patient. She realized that values and beliefs were passed on from generation to generation, and that can also have as much of an effect to a patient's health and reaction to treatments or just being in a healthcare setting. And in transcultural nursing practice, according to the patient's cultural consideration, begins with a culturological assessment. What a culturological assessment is how the nurse asks about the patient's culture, background such as race, ethnicity, religion, nationality, even, and takes them into consideration while assessing, their usual health, practices that you would do for every patient. It also can include like family patterns, health practices, food preferences, diets. And once the assessment part is complete, the nurse uses that culturological assessment to create a nursing care plan that would also consider the background of the patient so we don't offend the family or the patient. And I'm going to read the scenario that we have to how we would apply this theory. So, a patient of Asian descent was admitted into a hospital for an infection and swelling on the abdomen. The nurse states that they have to take different pharmaceuticals in order for the swelling to go down and for the patient to feel better. The patient states that with their background, they typically do not like taking pharmaceutical drugs because they are perceived as harmful and addictive substances that should be avoided. Patient says that his culture believes in using herbal tea as medicine and believes that Buddha has everything happening for a reason, bad or good, and that is just life. So, in this scenario, the patient of Asian descent comes from a culture that dislikes pharmaceutical drugs because they're seen as harmful and addictive. So that's where we have the 4 C's come in with a scenario like this, which is the 4 C's is consider, cause, coping, and concern. So the first C is consider. This is where we consider the patient at hand along with the background assessment. And in this scenario, the patient was of Asian descent and is Buddhist, and that's their religion. The second cause is C, the cause of the problem. In this scenario, the patient was diagnosed with an infection that was causing swelling on their abdomen. And then the third C is coping. This is where the nurse asks how the patient takes care of themselves and what are their beliefs on their health practices and medicine. And here the patient states that they use herbal tea and medicines to cope with illness or pain. And the 4th C, it would be concern. This is where we ask the patient how they're dealing with said diagnosis. And here, with the diagnosis, the patient is Buddhist, and their religion believes that Buddha has everything happen for a reason, and good or bad, and that's just how life works. So to him, the infection and swelling on the abdomen is just a natural part of what should happen to him in life. So he's dealing and coping with it pretty okay. Like his concern about his health is pretty okay. And then after this assessment, what the nurse would do is they would use this data to plan a goal of how to treat the patient with their specific beliefs in mind and practices to the best of their ability and document appropriately. And now we'll do the last slide. All right. So the comparison to personal philosophy of nursing.
The statement outlining a nurse's values, ethics, beliefs, as well as their reasons for choosing the profession serves as their nursing philosophy compared to Madeline Leininger's cultural diversity and universality theory is that we as nurses should give the patient the best possible care and need to be aware and respectful of their many cultural traditions.
Our personal philosophy of nursing is providing our patients with the best care by making sure that they feel well respected and comfortable with the care that they receive from us.
And the cultural diversity nursing theory is a nursing discipline that is an integral part of how nurses should practice and will always be vital in the healthcare field. Thank you.
Thank you.